Hello everybody, and welcome to Grossed Out. Today we're going to be looking at diseases of the urinary system. If you are new to this series, grossed out is kind of a silly term that pathologists use for cases that we were able to diagnose grossly or without using a microscope. So this series looks at classic gross lesions that veterinarians may see in practice, or perhaps in their systemic pathology course. For each disease, we're going to discuss what it is briefly, and also how to identify it when you are looking at a gross specimen or an image. We will start with some congenital anomalies of the urinary system. The first one that we're going to look at is hypoplasia of the kidneys. Hypoplasia is failure of an organ to develop to its full size. So in the kidneys, you can identify this by seeing that one kidney is much smaller than its partner. In this case, the small kidney is going to be the affected one. Polycystic kidney disease is a hereditary disease that we most commonly think of in Persian cats. You can identify this disease by seeing numerous variably sized cysts within the cortex and the medulla. Those cysts may also contain clear fluid. Ectopic ureter is a ureter that does not insert into the bladder, but instead inserts into the urethra. To identify this condition, you need to look at where the ureter is attaching to the bladder specifically. These patients will also have a history of chronic urinary incontinence. Finally, we have patent urachus. This condition arises when the fetal urachus that goes between the umbilicus and the bladder fails to close. This results in a direct channel between the bladder and that umbilical area. To identify this condition, you want to look for a large tubular structure that is leaving the bladder that is not the bladder neck. Next, we're going to look at some vascular diseases. We're going to start with infarcts, which are areas of tissue death that occur due to vascular thrombosis. Acute infarcts are ones that have happened recently and are recognizable due to their dark red hemorrhagic tissue. After 2 to 3 days, these hemorrhagic areas will become pale due to loss of hemoglobin. However, they will still bulge outwards beyond the confines of the normal renal capsule due to cell swelling. Subacute infarcts are older infarcts that haven't quite scarred down yet. They are identifiable by their white to tan centers of necrosis. The edges of these areas may be more pale due to infiltration of leukocytes. These areas are also going to have a prominent red rim of congestion surrounding that necrotic area. Chronic infarcts are areas of infarction that have healed by scarring. That scar tissue is going to contract, which forms a depression within the kidney surface. These infarcts are typically white to tan and have sort of a shrunken appearance to them. Septicemia can also cause vascular changes, typically leading to multifocal hemorrhages across many different organs. There are numerous potential causes of septicemia across our veterinary species. This particular example on this slide is erysipelotheryx in a pig. You can identify septicemic changes in the kidneys by seeing pinpoint or petechial hemorrhages over the renal cortex. Finally, we have canine herpes virus 1. This condition occurs in young puppies and causes hemorrhages due to vascular damage by the virus. You can identify this as petechial and ecchymotic hemorrhages over the renal cortex in a young dog. Sometimes we refer to this lesion as a turkey egg kidney because it looks kind of like a turkey egg. Next, we'll look at some inflammatory diseases. Amyloidosis is typically secondary to chronic inflammation in our veterinary species. Amyloid on its own is usually pale or white, but pathologists often stain the tissues with Lugol's iodine to highlight that amyloid. This makes the amyloid appear as blue-purple, as you can see in the right-hand image. Embolic nephritis occurs from septicemia, causing bacteria to lodge in the small vessels that are within the kidneys. This results in multifocal small abscesses throughout the kidneys that appear as white or yellow. White spotted kidney is kind of a variation of embolic nephritis that is described in cattle. It typically reflects a previous bacterial infection that resulted in embolic showering of the kidneys. We see these as white nodules or scarring where the abscesses may have been previously. Chronic interstitial nephritis results in inflammation that typically heals by fibrosis. Since the entire interstitium, or the area that's between the tubules and the glomeruli, is affected, this results in a kidney with a sort of pitted appearance on the surface and cut section. This is because the interstitium, when it scars down, is going to shrink, and it's going to leave the tubules and the glomeruli relatively patent and enlarged, which means that you get this sort of cobblestone appearance of shrunken areas and enlarged areas across the entire kidney. Pyelonephritis is inflammation affecting the renal pelvis, resulting in purulent material accumulating within that area. You may also see hemorrhage within the renal pelvis. In the renal medulla, you can often see radial red or gray streaks due to inflammation. Papillary necrosis refers to necrosis of the tips of the papillae, which are pyramid-shaped structures that are present embryologically within the kidney. Depending on the species, these papillae may or may not be visible in the adult animal, as they often fuse together to form what we call a renal crest. Papillary necrosis typically occurs secondary to NSAID toxicosis, and it appears as necrotic tissue within the medulla near the renal pelvis. Feline infectious peritonitis causes multifocal pyogranulomatous areas of inflammation throughout the body, secondary to the vasculitis that develops in this condition. In the kidneys, we see this as white to tan sort of plaques that are bulging from the capsular surface. These plaques often follow the vessels of the kidney. As a side note, FIP can look a lot like renal lymphoma. However, renal lymphoma is usually not centered around the vasculature and is more randomly spread across the renal cortex. It also tends to form more nodular structures than sort of plaque-like structures. Next, for our inflammatory diseases, we have emphysematous cystitis. This is a bladder infection caused by fermenting bacteria in the bladder that break down a source of glucose and release gas. We most commonly associate this condition with diabetes, which provides that source of glucose in the urine. You can identify this disease by seeing small bubbles within the bladder mucosa. Sabulous cystitis is a disease of horses that is secondary to bladder paralysis. This results in inflammation of the bladder and accumulation of this sand-like or sabulous material that you can identify grossly. Follicular cystitis occurs in dogs with chronic bladder inflammation. The chronic inflammation causes aggregates of lymphocytes to form, which we can identify as gray to white nodules on the bladder lining. Next, we will look at two common renal pigmentation conditions. The first is hemoglobinuria nephrosis. This occurs due to renal filtration of hemoglobin in the bloodstream. Causes of hemoglobinuria can include chronic copper toxicity in sheep, red maple toxicity in horses, immune-mediated hemolytic anemia in dogs, and babesiosis in many species. This condition results in diffuse dark staining, particularly of the renal cortex. Cloisonné kidney refers to pigmentation of the proximal tubules in goats, causing a brown or black renal cortex. This change is not thought to be significant to renal function. Now we will look at some obstructive diseases. Urolithiasis refers to stones in the urinary tract, and they can occur anywhere along the urinary system, from the renal pelvis to the urethral opening. You can identify them by seeing stone-like material within the urinary lumen. Hydronephrosis is a consequence of compression of the renal architecture due to an obstruction. Urine production does not stop when the urinary system is blocked, causing accumulation of fluid within the kidneys and other structures. In the kidney, we can identify hydronephrosis as large cavities within the renal medulla that kind of highlight the architecture of the kidney. This differs from polycystic kidney disease, which will produce randomly scattered cysts that are not highlighting that architecture. Hydroureter also results from obstruction, causing dilation of the affected ureter. A hydroureter may rupture and can also cause uroperitoneum. You can typically identify a hydroureter by comparing the ureter to its partner and seeing that it has an enlarged size. Next, we will look at some neoplastic conditions. Renal adenomas are benign tumors of the tubular epithelium. They typically appear as well-demarcated solitary nodules within the kidney. This contrasts with renal adenocarcinomas, which are malignant tumors of the tubular epithelium. These are typically more invasive masses that often have large areas of necrosis and hemorrhage associated with them. Nephroblastoma is a tumor of the embryonic tissue that typically produces these large, lobulated masses that have areas of necrosis. Confirming the exact type of tumor does require histology to diagnose definitively. Renal lymphoma is typically metastatic from somewhere else in the body. It can be nodular like you might expect, but one unique presentation of this neoplasm in the kidney is a diffusely pale renal cortex. Transitional cell carcinomas are tumors of the epithelial lining of the bladder. They are often proliferative and have a sort of frond-like appearance, or they can appear as just areas of roughening and thickening in the bladder lining. Botryoid rhabdomyosarcoma primarily occurs in dogs and is a tumor of the bladder muscle. This tumor forms masses in the bladder that are shaped like a bunch of grapes, which is what the name botryoid is referring to. Finally, we have bracken fern toxicosis, or enzootic hematuria. This is a condition primarily of cattle that occurs due to toxic metabolites from bracken fern ingestion being excreted in the urine. These metabolites are carcinogenic and cause typically proliferative tumors within the bladder. Lastly, we will look at two parasitic diseases. The kidney worm, or Staphylococcus dentatus, is a worm that affects pigs. They typically appear as small worms that are encysted in the perirenal fat, but they are occasionally found within the kidney. The giant kidney worm, on the other hand, is Dioctophema renale. This worm primarily affects dogs of our veterinary species. This is a red nematode that can reach up to 100 centimeters in length and invades into the renal pelvis. Over time, these worms can often completely replace the kidney tissue. Thank you for watching Grossed Out. If you enjoyed this video, remember to like, subscribe, and to share with your classmates. Thanks again for watching, and we will see you in the next video.